All right, so we're going to pick up where we left off and talk about integumentary skin or integumentary system, which actually refers not only to the skin but also to other connective tissue. And so you can see the various layers. Excuse me. Wow, you would think I hadn't been doing this for the last hour. Pen, there we go. All right, so you can see the various layers. The subcutaneous layer is going to be immediately below the dermis. And then you have this one layer here that separates the subcutaneous from the muscle, and that's called the fascia. And the fascia is this very tough tissue. And I'm sure a lot of you have probably experienced this. If you eat beef or if you eat pork, you're not as likely to see it in chicken, but if you eat beef or pork, oftentimes there will be this layer that covers a roast perhaps, and it'll be almost impossible to cut with a knife even, and it's very different from the cartilage, right? And it's like a sheet. Well, that fascia covers entire muscle groups, and it acts watertight, and in fact it really is watertight. And it's important to remember that, because let's say you have a blood vessel buried in this muscle, and something horrific happens, blunt trauma of some kind, and this blood vessel ruptures open and starts bleeding and filling this compartment with blood. Because of this fascia, let's say the fascia wraps the muscle, all this blood is going to pour into the muscle, and this is going to act almost like a rubber band. It's going to squeeze and compress the muscle trapped in that compartment that's bound by that fascia. And as the volume of blood starts to empty into the muscle instead of traveling through the blood vessels but pours into the muscle itself, that fascia can serve to compress that everything in that compartment, and that is called compartment syndrome. So you will often have small blood vessels that run through here, right? And you might also have nerves that run through there as well. And both the blood vessels and the nerves will get compressed by that increase in pressure. So the fascia is notable in that regard. Now, above the subcutaneous fat is going to be the dermis itself. And you can see that we have a lot of structures that pass through the dermis. Among them are going to be primarily your blood vessels, and you'll also have nerve endings that travel through here as well. But then you can see that by the time you get to the epidermis, this section at the top here, the nerves that are left branching through here are very, very small, right? So you still have innervation here, but the nerves get smaller the further you go from the base of the nerve. So the functions as the largest single organ in the body tend to fall into three categories: protection from the environment, regulation of body temperature, which is a big one, particularly in small children. They have a very immature thermoregulatory ability, so that's important to know. And when children get burned, first of all, they will burn at a lower temperature and a shorter duration exposed to that lower temperature. So because they burn so easily and they have an immature thermoregulatory system, if you interrupt the integrity of the skin, they're going to have a much more difficult time thermoregulating, all right? And in addition to that, its other major function, of course, is to transmit that sensory data to the brain. So the brain, again, that affect, what's affecting the body, so that the brain can then generate an effect so that the body can tolerate whatever is affecting the body. All right, so the skin plays a really important role in that regard as well. So we'll move on to the digestive system. And one of the biggest tasks that you can think about at this juncture is starting to remember where all these organs lie in this cavity. So you see that you have your diaphragm up here. All right, it's sitting high in the chest, as you note. Okay, so your lungs are basically going. The apex of the lung is going to be up here roughly, and your lung is going to be shaped something like that. So as the diaphragm drops down, it'll bring the lungs with it, as we discussed before. Now immediately underneath your diaphragm is your liver, and you'll see how the lion's share of it is going to be on your patient's right side. So remember, anatomic position, and this is our patient's right side, and this is our patient's left side. And that can be a challenge as a new provider to remember that we're looking at the patient and we're remembering which is their right and left. So most of the liver is going to fall on your patient's right side, and buried underneath it is the gallbladder. And that's going to feed into the stomach to help break down fat. So the gallbladder will help collect bile from the liver and also will store bile from the liver and then feed it into the stomach to help with the digestion of fats. What else is notable about the liver? It's a very, it's considered a solid organ, which means it's highly vascular. Lots of blood vessels traveling through there, which means that if it gets struck with a blunt object or penetrated with a penetrating object, it can bleed heavily. And then the last thing is there's this ligament that travels through the body of the liver, and that's what helps hold the liver in place. But if you can imagine this body is moving forward at 55 miles an hour, imagine a very heavy piece of jello that's got a rubber band wrapped around its section to kind of help it stay in a bowl. And if you suddenly shake that bowl, the piece of rubber band will stay in place if it's adhered to the bowl, but the jello will slosh forward, and that rubber band will dissect that bowl of jello. And that's what can happen with this ligament when people are involved in high-speed motor vehicle crashes. Your seatbelt will hold you in place. The muscles in your chest and the structures in your body will help, for the most part, hold a lot of your organs in place, but they will shift. And as the liver shifts forward and slams against the inside of the body, this ligament can often serve to dissect the liver. So just some interesting structural factors to consider. You've got your esophagus, of course, that travels through the thorax and actually comprises part of the mediastinum. And your mediastinum is this portion of the body right here. So your esophagus is one of the structures that travels through the mediastinum. I'm wondering if you can guess what other structures you would find in this area. So just kind of briefly think about it. You've got a trachea that travels through here. Obviously your heart is going to be sitting in this area. And then you've got your aorta that branches off of the heart, as well as your vena cava. And all those structures comprise your mediastinum. So your esophagus is traveling to your stomach. And buried behind your stomach in the upper left quadrant, kind of on the lateral presentation of the body, is going to be your spleen, which is actually serves some immune properties and is important with the formation and storage of red blood cells. And then we have from the stomach, going behind this cross section of large intestine, is where the stomach is going to attach to the small intestine. And it's in these structures here that you've got absorption of nutrients taking place. Okay, so the nutrients will leave the small intestine and start to permeate into the blood vessels, and that will carry the nutrients throughout the body. Waste products will then be transported into the colon. So when the small intestine finishes pulling out nutrients, what's left will end up in the large intestine. And the large intestine has the appendix, this little appendage that's sticking off of this one section in the lower right quadrant of your abdominal cavity. So you'll note that both the small and large intestines make an appearance in all 4 quadrants of the body. And then behind these organs is what's called your retroperitoneal space. So peritoneal space. So retro meaning behind, peritoneal meaning this area. This is your peritoneum. And there's a membrane that separates your retroperitoneal space from your abdominal quadrant, and roughly behind this area you've got your kidneys. All right, so let's see if we can change the color of the kidneys. So you've got your kidneys that are sitting back there. They have their own blood supply. The kidneys are going to have ureters that branch off of them and lead to the urinary bladder, which is going to sit roughly in here, buried behind your abdominal organs. And then your urethra is going to branch off your urinary bladder. And in the male patient, it'll exit through the penis, and in the female patient, the urethra exits right above the vaginal orifice itself. So learning what organs are in the 4 quadrants is important. Now there's another organ that we have not mentioned, and I want to see if I can get that drawn in there. You also have your pancreas. And your pancreas can kind of appear, again, buried. Actually, I have that way too low. Your pancreas is buried behind the stomach and the intestines, and it typically will make an appearance in the upper 2 quadrants, and it's this kind of strange J shape. And you'll again find it behind the stomach and small intestines, and it will also be triggered by your eating habits, and will feed into the small intestine to help break down sugars so that the cells use them as food. Now, interestingly, if you remember, we had a slide a couple slides back of your vascular system, and you'll note that your lymph system is very similar to your vascular system, and in fact they travel in tandem throughout much of the body, and there's an exchange of water that takes place, plasma that takes place throughout the lymphatic system, and that allows the lymph system to feed white blood cells and antibodies into the vascular system and draw them back out again, and that's happening throughout the body. All of these organs and structures and glands all are part of the immune system as well. So the lymphatic system aids the immune system in combating disease. So your endocrine system is basically a system of chemical messengers. And anytime a function needs to occur, oftentimes the way that will occur is through the use of hormones as chemical transmitters of information. So you have your hypothalamus and your pineal gland, pituitary gland, and your parathyroid. You can see your thyroid thyroid gland is there, adrenal glands on top of the kidneys like we talked about, and your pancreas making that little loop in the upper right and left quadrant like we talked about, as well as the ovaries in females and testes in males. So again, the role of the endocrine system is to secrete hormones that will then direct the body to do something. So in the instance of the pancreas, the primary hormone that it secretes is going to be insulin, right? And insulin simply directs body cells to utilize glucose as food. So it's basically telling the body, hey, use glucose as food. And without that direction, the body won't use the glucose as food, and instead the glucose will stay in the blood vessels. All right, and that's all that hormones do, is direct other functions and direct other organs to perform other functions in the body. So the brain may control the release of hormones either directly, or will send a signal to the organs or to the endocrine organs to direct them to do that. Also, what may happen is the brain may direct the pituitary gland, and then oftentimes the pituitary gland will direct other glands to dump their stores of hormones. So it can happen in multiple different ways. If you have too many or too little or too few hormones in the body, that can lead to a disease state. All right. Then you have your genital system of the female side of the human species, and the primary organs are going to be the uterus, where gestation takes place, and basically we have fallopian tubes, and we also have ovaries. Ovaries are going to release an egg. I forgot to press the pen button, so that means yes, I moved forward ahead of time. So the ovaries will release an egg. Females are born with all the eggs they're ever going to have in their lives at birth, and through a process that results from hormonal stimulation of the ovaries, an egg will be released into the fallopian tube. It's not necessarily taking turns every month, but the egg will then begin to travel through the fallopian tubes, and at this point, if the woman has been sexually active, sperm cells will basically enter the vagina, travel through the cervix, and will continue to travel up both different fallopian tubes, having no idea which side has released an egg. And typically when the sperm cell reaches the egg and fertilization occurs, then that fertilized egg, will make it a little bit larger, will then begin to travel. And let's change the pen color. The fertilized egg will then begin to travel through the tube and attach in the uterine wall. And then over time a placenta will develop, and then a fetus will develop from there. All right. And that's basically the down and dirty of it. And of course we will go over that when we talk about OB and GYN emergencies. And then on the male side, we have a slightly less complicated plumbing system here. You have your epididymis and your testes, and there's the storage and production of semen that takes place there, and then it's going to pass up through the vas deferens, and this will be the site of where, forgot to press pen again, this will be the site where having a vasectomy will occur. Is typically there's going to be a severing or a tying off of the vas deferens to prevent pregnancy, and then it gets fed again through the vas deferens and then out through the penis, utilizing the same channel, the urethra, as urine will exit the body as well. All right. Now all of these structures, of course, are contained in the scrotum, which is highly sensitive to temperature differences as far as sperm production goes as well. All right, so your life support chain will basically require a constant supply of oxygen, nutrients, removal of waste. It's constant and it's ongoing. The circulatory system is going to be integral in acting as the carrier of both the nutrients and the wastes. All right. If there's any interference in this process of delivery of oxygen and removal of carbon dioxide, cells can become damaged. Once the cells can become damaged or injured, that can trigger a cascade of events that can lead to healing eventually. But if enough damage occurs, then that cascade of events can actually lend itself more readily to even more damage occurring because of swelling that occurs. And once you get swelling in a small space, it compresses the other structures in that space, and then they get compromised. So it can help most of the time as long as the damage is not too huge and there's room for the tissues to swell. But in certain areas of the body, that it can be harmful. All right, so your cell food is going to be glucose. So it's C6H12O6, all right? And the metabolism of glucose is how we get our energy in the body, all right? And that energy that's created from glucose is called ATP, adenosine triphosphate, all right? And we get adenosine triphosphate through the breakdown of glucose in the body. Now, the most beneficial means of breaking down glucose in the body is through the use of aerobic metabolism utilizing oxygen. That's the most effective production of ATP. However, you can create ATP in the absence of oxygen for short periods of time, and that's called anaerobic metabolism, and that leads to the production of lactic acid. And all of us have probably experienced that, and that leads to muscle aches. All right? So our life support chain begins with the process. All of these processes occur because of diffusion. All right? And diffusion is the movement of particles from an area of low concentration to an area of high concentration. And that allows the particles of oxygen to trade places from one side of the cell membrane to another side. So it'll go from an area where there's a lot of oxygen to an area where there's a little bit of oxygen. And the same is true for carbon dioxide. Now, in order for this process to take place, you have to have an appropriate pH in the body, which is 7.35 to 7.45. Now, if you don't have the proper pH, it will interfere with your body's ability to utilize these different means of transferring nutrients and waste products, as well as the transfer of water. But it's particularly going to have an effect on diffusion. And so diffusion, again, movement of particles such as oxygen, carbon dioxide, nutrients in and out of cells is going to be affected largely by pH. Now, similar to that is osmosis, which is the movement of water droplets. Both of these processes will rely on the concentration gradient, meaning they'll travel from areas where they're highly concentrated to areas where there is a lower concentration. And they do that passively. It's kind of like when you drip some food coloring into a bowl of water. Those particles of food coloring left alone will eventually color all of the water. And even if there's a permeable membrane, if the permeations or holes in the membrane are large enough to allow the little molecules of food coloring, eventually it'll still equalize on both sides of the membrane. Now, pathophysiology is the study of disease and what happens in the body as a result of disease. So what we often talk about on the EMS side, the pre-hospital side, because a lot of our calls are related to trauma, is going to be respiratory compromise. That's a big one. And that's going to be the inability to breathe effectively so that you get a good oxygen and carbon dioxide exchange. So typically that's going to be a result of a ventilation problem, right? And remember, we said ventilation was mechanics. And if you can't properly ventilate, meaning draw air in and expel air adequately, then that's going to affect how well respiration occurs. Because again, respiration is the exchange of oxygen and carbon dioxide, the gases within the cells. So the two are interdependent. And if we cannot ventilate, then we're probably not going to be able to achieve respiration, adequate respiration. So when we don't have adequate respiration, or secondary usually to inadequate ventilation, then we can end up having these states of hypoxia and hypercarbia. Hypoxia is not enough oxygen in the tissues, and hypercarbia is too much carbon dioxide in the tissues. If you have too much carbon dioxide in the tissues, it will shift your pH. It will make you more acidotic than you should be. And if you're more acidotic than you should be, it's going to slow down impulses coming from the brain to the body. So remember, all that information that channels up to the brain so the brain can create a response, that speed of transmission of message will be slowed down if your pH becomes too acidic, too high. In addition, you can have blood and fluid loss. So you might be breathing just fine, but if you've lost a lot of blood, since blood carries oxygen and carbon dioxide, your ability to exchange them might be hampered. And that is true for fluid loss as well, because when you're vomiting or have a lot of diarrhea, that watery component is being expelled from the body, and so the body will start to draw from its reserves. And one of the first places that you can find a source of water, of course, is going to be in the bloodstream. And the bloodstream is going to start sucking water from the cells to try to replenish itself. But eventually, when the water content starts to get too low, that's going to affect how well blood circulates in the body also. And then if you have injury to the tissue, that can affect the ability to circulate blood, because maybe the volume is reduced, or it can compromise the vessels themselves. And once you impede circulation, then you've impeded the ability to exchange gas as well. And that condition is called shock. When you are no longer able to exchange gases in the tissues well, for whatever reason, whether it's because there's not enough fluid so that the blood can't move as freely as it usually does, whether it means because you're not getting enough oxygen in because your chest is not moving correctly as it should, or your diaphragm isn't moving correctly as it should, then that can cause the blood to not be as well oxygenated. All these causes end up with the same result of shock, which is that tissue is not getting enough oxygen brought to it, and it's not having the waste products removed from it. And that is called hypoperfusion, which is otherwise known as shock. And it's categorized into different types based on the cause of the shock, okay? So the effects are that the level of oxygen supplied to tissue, it drops for any number of reasons. The cells start to go into the anaerobic metabolism. Remember, we talked that cells can do that, but there's going to be more lactic acid. So in addition to the regular acid that is produced from cellular work, which is carbon dioxide, they also are going to produce lactic acid. So now you have cells that aren't being perfused well. They're not being given oxygen. They're generating more waste than they normally do, which means that the waste can't be rid of. That's going to make your body become more acidic, which is going to then slow down transmissions from the brain. So you get the severe metabolic acidosis. The baroreceptors, which are receptors in your blood vessels that sense the amount of pressure in the blood vessels, they're going to sense some kind of loss of pressure in them. Maybe it's from the blood loss initially. So something will stimulate the release of epinephrine and norepinephrine, and we know that is adrenaline. The heart rate's going to start to increase, and the heart rate's going to try to compensate for this loss by circulating whatever blood has oxygen still attached to it more quickly throughout the body. And then your interstitial fluid, that's the fluid that's sitting in between the cells, is going to start moving into the capillaries. And that's going to help to plump up the volume in the blood vessels, because the body's thinking that we're experiencing a loss of blood somewhere. So it's going to try and pump up the volume of the blood to allow circulation of the red blood cells more readily. This slide says impairment of cellular metabolism. If you impair the cell's ability to break down sugar and use it as fuel, then again the cell is going to try to go through the anaerobic metabolism route. And as we talked, you can end up with metabolic acidosis. The other piece is that your brain cells don't use other forms of fuel as readily. So if you decided to go on the keto diet and didn't take any simple sugar in, your brain would be forced to derive sugars from the other sources of food that you're eating. So if you're eating something that's high in protein, protein is actually comprised of forms of sugar molecules, but you have to work very hard to break all that down before you can break it down into the sugar. And so brain cells have to have sugar to be able to function, and if it doesn't, then the brain cells will not function well either. So any cellular injury that can occur from cellular metabolism not working as it properly should can cause the cells to become injured over time. So this is a quick review of what we talked about today. So which of the following is found in the retroperitoneal space? So I'm going to give you a second to think about it. The liver is in the peritoneum. The spleen is in the peritoneum. The kidneys are behind the peritoneum, so that means retroperitoneal. So the kidneys are retroperitoneal in that space, and then the stomach, of course, is in the peritoneum itself. The most prominent landmark on the neck, on the anterior surface, that's the front surface. The mastoid process is not on the anterior of the neck, so that is not it. Your cricoid cartilage is actually smaller than your thyroid cartilage, so cricoid is not the answer. Thyroid is the most prominent because the cricothyroid membrane is a tiny little membrane between the cricoid and the thyroid cartilage. Which of these connects muscles to bone? You're going to find these answers in your textbook as well. All right. So tendons connect muscle to bone, and ligaments connect bone to bone. So tendons is the correct answer here. The cartilaginous tip of the sternum. So the costal arch refers to the way your ribs curve, right, up to where they meet, and they meet at the sternum. The manubrium is the body of the sternum itself. The angle of Louis is going to be in the top third of the sternum, and the xiphoid process is that pointy little cartilaginous tip of the sternum that if you follow the curve of your rib up until where it meets in the center and press gently, because that's where the xiphoid process is, you could, if you press on that too hard, you could accidentally lacerate the liver. All right? So which of the following statements about red blood cells is false? Well, they do have iron. They do carry oxygen. They don't fight infection. White blood cells do that. And they do give color to the blood. So the statement that's false is fighting infection. And that's all I have for this presentation for the anatomy and physiology. So I'm going to stop here, and then I'm going to do a third and fourth video. The third video will be an introduction to patient assessment, and the fourth video will be on patient assessment itself. All right, so again, apologies that the weather is not cooperating, but we'll power through. Thanks a lot.